Hello, Tony Baratta here. I wanted to talk to you today about 5 therapies that every person who suffers a traumatic brain injury should have in order to achieve full recovery. Did you know that there are 529,000 people actively in the state of Pennsylvania who have suffered an acquired brain injury? This is the kind of injury that someone suffers in a car accident, a fall, a traumatic event, or maybe even a stroke. And the key here is that the sooner a person gets treatment, the better the outcome is likely to be. And these 5 treatments that I'm going to talk to you about are necessary. I recently represented a woman who was a competitive bike rider. She was in her mid-50s, and she was riding down the road, and a dog ran out from its driveway, its owner's driveway, and slammed into her bike. She was wearing a helmet, but she was slammed to the macadam and suffered a brain bleed. She was rushed to the hospital. Fortunately, surgery was not necessary, but they monitored her brain bleed, and she had suffered the symptoms and the signs of a traumatic brain injury. She was confused. She had balance issues. She had sensitivity to light and sound. She had severe headaches. She was having nausea and vomiting, and these were continuing. So she got some treatment after the hospitalization through a rehabilitation center. And then she got some inpatient rehabilitation, then some outpatient rehabilitation. And she received these 5 treatments. First, she received physical therapy, which helps improve your strength and your coordination and your flexibility. She also received occupational therapy. That helps you improve the tasks of daily living, like bathing and dressing and cooking and cleaning. Then she also had speech therapy. And speech therapy is important for helping a patient to form words, to form sentences, and even to use devices like cell phones or iPads or other communication devices. And she also received psychological therapy. And psychological therapy is so important in a traumatic brain injury because there are many mood changes and psychological changes that occur when a person suffers a traumatic brain injury. So if a patient gets physical therapy, occupational therapy, speech therapy, cognitive therapy, and psychological therapy, a patient is likely to have a much better chance of recovery. This woman who was the bike rider, she, after 4 months of this intense treatment, was able to go back to work and soon thereafter resume her competitive bike riding. Now, not every person has these kind of dramatic, successful results, but if you're going to have successful results, those 5 therapies are key. My name is Tony Baratta, and I hope this was of assistance to you. Thank you.